Hi, my name is Alexis Fritz, and my partner is Casey Rodriguez. For this Prezi, I will be talking about how to screen for finger agnosia. The objectives will be to define finger agnosia, to understand how to screen for finger agnosia, and also how to determine if the patient has passed or failed the test. And I will be describing appropriate client populations that this screening may be used for. So what is finger agnosia? Finger agnosia is considered a body schema perceptual disorder. Body schema is simply the awareness of the spatial characteristics of one's own body in space. And finger agnosia actually results from a right hemisphere lesion of the brain. So what is finger agnosia? It is the impaired perception of the relationship of the fingers to each other. Patients that are diagnosed with finger agnosia have difficulty identifying and localizing their own fingers. Applicable client populations for finger agnosia include traumatic brain injury, stroke or CVA, Gerstmann syndrome, and patients with dementia or Alzheimer's. For those of you who don't know, Gerstmann syndrome is a rare neurological disorder that's characterized by the loss of 4 specific neurological functions, one of which being finger agnosia. Now we will talk about specifically how the therapist will administer the test. First, you will instruct the patient to carry out the following commands. The first set of commands include asking the patient to show them your thumbs, then ask them to show me your index fingers, and then to show them their ring fingers. After that, you will ask the patient to touch their ring finger to their thumb, and this will be done on the patient's involved side, or it can be done bilaterally. Next step is to ask the patient to touch their index fingers together. And finally, you will ask the patient to touch their little finger to their thumb. And this can also be done on the involved side or bilaterally, depending on the patient. Now we will watch a video that shows how this screening is performed. Now I will show another video that talks about the perspective of the evaluator when they screened a person that actually had finger agnosia. It will talk about some of the symptoms that show up when this person gets tested.
The following describes an examination of a stroke patient for finger agnosia. It was very difficult for him, the patient, to name his fingers on command. He frequently mixed the index and middle fingers. He seemed unable to number his fingers in any constant fashion in a given direction. When the examiner's hand was placed beside his own, and he was told to copy movement, such as touching with the index finger of his other hand, the same finger the examiner had touched, he did it accurately. However, if the examiner's hand was placed beside his in the opposite direction, he made frequent mistakes for the central fingers. When his eyes were closed, he was often inaccurate in naming the finger touched, either on his right or on his left hand.
Now we will talk about how this test is scored. A person is considered to have failed this test if they are unable to demonstrate half of the commands that are given by the therapist. Finger agnosia also correlates highly with poor dexterity and tasks involving movement of fingers in relations to others, which may be seen during this test. So an overview of this Prezi as we went over the definition of finger agnosia, populations finger agnosia is present in, how to test for it, and also how to determine if the client has passed or failed the exam. Thank you for watching.